Welcome back to the Practitioners Rise podcast. I'm your host, Hailey Krajewski, and this show exists because I believe that when practitioners rise, entire communities rise with them. And today's episode is a perfect example of exactly that. My guest, Dr. Erica Boland, a chiropractor, certified professional midwife, and co-founder of Coulee Health and the Coulee Health Birth Collective in Wisconsin. She has built a model of care that brings together perinatal chiropractic, midwifery, movement, and support for both mom and baby, honoring them as the connected system they were always designed to be. Her story started the way so many of the best ones do, with a personal experience that cracked everything open. She had her first son at 19, and that moment set the entire trajectory of her life into motion. From there, she traveled to Prague to study chiropractic, built a practice from the ground up, and has become the voice for the kind of birth and postpartum care that more women deserve to know exists. I wish I knew Dr. Erica when I had all my babies. So, whether you are pregnant, postpartum, curious more about natural birth options, or simply someone who believes that women deserve to be heard and supported on their health journey, this episode is for you. So, welcome, Erica. I am so glad you're here.
Thanks for having me.
So, in the intro, I mentioned that you had your first son at 19 and that it completely opened your eyes to birth work. So, can you just share more about your experience and tell us your story?
Sure. So we unexpectedly found out that we were expecting when I was 19, and I was raised in the medical system. I would say, like if you were sick for any reason, you went to the doctor. And so when I found out I was pregnant, I entered the hospital system and just did what they said would be happening next all along the way, and didn't know what I didn't know. So his birth was extremely medicalized. Looking back now, I realized I was induced, and postpartum was really isolated and disconnecting. And he ended up spending 5 precautionary days in the NICU and pretty much everything but a C-section. And even though I didn't really have a holistic community around me whatsoever, I I saw the chiropractor once in a while in middle school and a high school for headaches or like sports injury or whatever, but truly didn't really have a holistic community around me. So what I can attribute it to, and I think that probably a lot of your listeners realize in some regard, like, oh yeah, that's when I found my calling, or it was this deep instinctual that did not need to be that way. Like that can't possibly be how babies need to come into this world. And yeah, like I said, postpartum was really disconnected. They send you home with a human. I had no idea what I was doing. And we had a ton of family support around us, but not really much in the whole holistic realm. But it just gave me this hunger for, okay, I want to be a midwife because I want to help people not have that experience. Which is interesting looking back because I had a midwife in the medical system and still had that experience. So, yeah, I started to learn a little bit more when we got pregnant with our second. I read the book Pushed by Jennifer Block, and we had a doula at his birth. And then I became a doula, and I was a doula for 10 years. And I had a Reiki session. In the meantime, I went to chiropractic school and became a chiropractor. And I had a Reiki session where she told me that chiropractic was a stepping stone. And I was like, what? But I absolutely love how I can blend those worlds together now. And I truly wouldn't change how that trajectory went. But yeah, the experience with him, while it felt so medicalized and, like I said, disconnected and just more systematized than an experience, it fueled me. So I'm thankful for it.
I look back at my births too, and it's like you don't know what you don't know when you're in it.
Hmm.
You can look back on it, like you said, you see, like, that should have felt different. That should have been.
Yeah.
So I think sharing your story and sharing what we're about to share too just helps people understand maybe before they even get into that position too. So we talked about you're both a chiropractor and a doula and a midwife, and many might see those as separate worlds, right? So how do you connect the two, or how do you see them as one connected?
So when I started chiropractic school, I was actually in nursing school to become a midwife, and my husband was in chiropractic school. And I was so interested in his coursework. He was in embryology and he was in anat and phys, and I was just so intrigued by the body. And I switched, I left the nursing program, switched to chiropractic school, and just really started to learn more about the way that we move and what it means to be healthy and seeking health care rather than just sick care. And I did a lot of time in the rehab department at Palmer in Davenport, Iowa. And then, like you said, I went to Prague. And who I shadowed in Prague was actually a physiotherapist who I'm still close with. And she's a big mentor to me. But I was like, at that time, I didn't want to be a prenatal chiropractor. Everybody was a prenatal chiropractor. It's kind of funny how the things that we judge or stigmatize come back into our life so strong. And looking back, even just now, it's like I was just so obsessed with movement. And I think part of what really fueled that for me, which I haven't shared this before, is when I was in chiropractic school is when I actually really got physically healthy, like, running and starting to strength train. And it was then that I realized that I could either stay on antidepressants or I could move my body and eat well. And that changed my life too. So the obsession with birth, if you will, and the obsession with moving your body. And I just started to follow these trails of interest. And I was actually in school working a lot with kids with special needs, just based on being in the rehab department at the time that I was, and really, really got into developmental milestones. And when I went to Prague, I realized, oh my gosh, we're doing all these sit-ups and crunches and Kegels with women, and all we really need to do is move the way that we were designed to across our first 18 months of life and like
Mhm.
come back into our bodies. And at the time, I was so much in my physical mindset, I didn't even really realize what it means emotionally and metaphysically to come back into your body. I just saw how important it was physically. And then, like, the spiritual, emotional, metaphysical trail would come for me eventually. I was pretty judgmental of it in chiropractic school, actually. So I think the combination of like, oh wow, we have this entire population of women that think it's normal to pee their pants or have prolapse, or like, you have a baby and sorry, your vagina's just different from now on, and there's X number of things you've got to live with. And nobody was talking about hormonal health and all of the things that, since social media has blown up, we hear so much more about now. But then it was like this big aha moment. And I am like such a dreamer in rose colored glasses. And I just remember coming back from Prague and thinking, like, okay, everybody needs to know this information. Like, how can we get this to the masses? And I started teaching for a company called BirthFit and traveling all over, teaching chiropractors and PTs and OBs and midwives how to help people really move their body. So I think like that chiropractic piece, the how we can, I think so much of what we do as chiropractors is brain body work.
Mhm.
And it's like whether I am laying my hands on someone or I'm helping them move, they're relearning what it means to be in their body. And that's so powerful. And it matters so much in pregnancy and so much in postpartum. And as I've gotten into midwifery, that's only further confirmed how important that really is on every level for mom and then for baby.
So, if it's okay with you, I want to unpack that like even just a little bit more. And when you're talking about this movement and how we're designed to move, even when you went back, like you said, the first 18 months of your life, like, can you unpack a little bit more about what that means or how we should be moving or
Yeah.
then how it relates, emotionally, mentally? Like you said, you were able to get off antidepressants. And I'm sure a lot of women, after they have babies or even during like that depression and anxiety, can creep back into. So,
Hmm.
it's a lot in one question, but if you could just unpack even like a layer deeper so that our
Yeah.
listeners understand like what can they do with this
Yeah.
information.
The first thing that comes to me is just everything is everything, and you aren't crazy. And your instincts are there for a reason, and whatever's going on for you, if you're feeling like this can't be how it is, and feeling that like hardship, I guess, it's because you're meant to figure something else out for yourself. And so I really truly believe when we have a team around us that allows us to step more into that advocacy for ourselves, it changes our entire family dynamic. So when you're moving well, like from a more physical level, when you're moving well, even prior to conception. Like there's Martina Jeskova, the physiotherapist in Prague that I had mentioned. She talks a lot about the work of Moshe Shova in functional fertility, meaning fertility issues based on restrictions in our fascia. And I mean, we're just now learning so much more as a general population about fascia. And so it's like, when you ask me to unpack it, I could probably talk about it for days straight. And to like simplify it, when you think about the core as a canister, if you're moving your body well, and then in blood flow and oxygenation and all that to your uterus and to the surrounding tissues, you're more likely to be able to get pregnant. And then when you do get pregnant, baby's more likely to have access to the full space, right? We talk about ideal positions for baby to be born. And I was just talking the other day with, I call her the matriarch midwife in our area. She's in her 70s and she's just a wealth of knowledge. And we got talking about baby position. And her and I was like so excited to hear, yes, this resonates with her too. There is no perfect position. That baby has to navigate the pelvis and the soft tissues and everything that they're coming through. So they will teach us how, like they do across their lifespan, they will teach us how they need to enter this world. And all that we can do is make sure that we're moving really well and nourishing our bodies really well to give them access to most of the space. When they have access to all areas of the core, the canister inside the uterus equally, they get better feedback on all areas of their body, right? And that matters because we talk about across the first year of life, the developmental milestones: rolling, crawling, sitting, standing, walking, all of that, that's innate. Nobody has to teach us how to do it. And that starts actually in utero. It starts at conception. And so the better that mom is moving and finding different, like moving in all planes and emotionally and physically working on breath and things like that, the more access baby has to that space, the better developmental milestones they're going to have across their lifespan, the better they're going to be able to emotionally regulate. Now, when we're talking about like peeling it back even further and looking at, well, where are women with their movement today? In the United States, we have a largely sedentary population. And I think that simply walking alone is an extremely underrated exercise. But that this starts like so much younger because it starts with orthopedic devices for infants, putting them in bouncers, putting them in exercisers, putting them in the Johnny jump up and putting them like all these little bumbos, all those things that change their developmental trajectory. And then we stick them in a desk at age 5 for years. And that's just not, we were designed to move and we were designed to be in sunlight. And we were just, all of these things that
Yes.
in general are taken away from us. And then we wonder why we have some of the fertility issues that we do and the C-section rates. And that's multifactorial for sure. But because of my wheelhouse and my passion, I see what movement and emotional and physical health plays a role in that.
So many things that you said just like hit. It's a lot of what I've been talking about too. And just like how our kids, like you said, they're placed in a desk at age 5 and they're not moving. And then even like if my husband was listening to this, because I was like, I went on a walk today. Like I was so excited because sometimes it's hard, like just to get on that walk.
Yeah.
But for my mood, it is so important. He's like, that's just normal daily activity. I'm like, I slapped him. I'm like, but it's something. Like I
Yeah.
did something, right? So
Exactly.
and
Yeah.
walking is a space for me to just unplug, like just look around, be in nature, like Yes, so underrated. But I love what you said too about that care for mom, right? So like you said when we kind of started is many people just have their standard OB appointments.
Mhm.
And they maybe give you a book or tell you like you should be doing 30 minutes of this a day or like there's nothing really that
Mhm.
we're taught in that experience. But I know what you're doing is like vastly different. And I think even at your space, you have a gym and your chiropractic office and then the birth center. Like it's kind of this amazing all in one, but you're educating along the way. So can you share more about, it's not just the chiropractic adjustment or just like what you're doing in those important appointments, but like how does it look different?
Yeah. Oh my goodness. That's how does it look different within our own office?
Well,
You're
I think
saying or how?
from what people normally experience is
Sure.
like us going to their month to month OB
Okay, gotcha.
what
Yeah.
they're doing. Sorry.
Yeah. No, 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 that's okay. So we have a birth center. There's 2 rooms there, or I do home births as well. And one of the most often questions I get is like, what's the difference between the birth center and home birth? Some people feel that the birth center is more safe. So the difference is location. We have the same medications, equipment, whatever, whether we're at your home or whether we're at the birth center. Some people live like way far away from a hospital, so the birth center might be a better option. Some people don't have home lives or home situations where they want to birth at home, or they might be like me, where I was like, I would love to not do a hospital birth again, but home birth is like, no, who does that? And I would have definitely done a home or a birth center birth for our second for sure, but did a hospital birth again because I thought, like, okay, I don't even actually know. Did I need all of that garbage or didn't I? Or what's my body actually capable of? And so those are some of the most common questions I get, but the care happens at a very similar frequency, but the appointments are a lot longer. So our visits are 45 minutes. Usually we do an initial visit at around 12 weeks. So you'll come in, most people anyway, come and meet me first for a 30-minute consult. And just, it's important that you feel supported by your team. And I try to really emphasize because we cannot promise outcomes no matter where your baby gives birth. And I think that, like, when you and I were having babies, we look back and we're like, man, I wish I would have had that type of support. And I've seen such a shift now because of TikTok and Instagram that people are like demanding better care and
Mhm.
options, right? And with that can sometimes come this like, okay, if I do all these things, I will get this beautiful orgasmic Instagram birth, which is also not necessarily true all of the time. But it's the whole experience that matters, not just the birth. And as a country, we get so focused on the birth, and the birth is the shortest part.
Yes.
Like
Yeah.
pregnancy is months long. Parenthood,
Yes.
that's forever.
Yes.
So, but it's like so cool to me. I'm so passionate about postpartum because every conversation that we get to have in your prenatal visits and that you and your significant other or, like husband or boyfriend or whatever, every conversation that you're having is practice for how you're going to raise your family. And so those are the things that happen across our visits. We talk about what options you have for testing and why they're in place, why they're recommended. What does it mean if you test or if you don't test? Everything from gestational diabetes to anatomy scans to group B strep testing to genetic testing to newborn cares of erythromycin, which is the eye ointment for the babies after birth. It's an antibiotic. And just things like that that most people don't realize, like, well, that was started because to prevent against gonorrhea, blindness due to gonorrhea or chlamydia, but that's not really what's educated across the board in the hospital. So it's told like, well, it prevents your baby from an eye infection. Who wouldn't want that, right? So diving deeper into some of those topics, the newborn screen, vitamin K, circumcision, vaccines, all of the things that are like taboo topics for some people. And some people that are like in the home birth world and that they've got family and friends that support that and they've been in it, it's a little more comfortable, and some that are navigating that for the first time, are simultaneously realizing all of the options they actually should have had last time. So we need to be able to like process through that in appointments and talk about your hopes and your fears and what it could potentially look like. And I get a ton of questions about transfers, rightfully so. Like, what would be a reason to transfer, and or how often does that happen? And the reality is that 80% or more of births is normal and physiological. And 20% of the time, do we need a little bit of intervention, even wiping the baby off after the baby's born, or like stroking the bottom of their foot to help them cry a little bit, or whatever. Any little thing that we do is an intervention. And it's like 5 to 7% that actually need medical help. So I'm a firm believer that birth should start in the community and be in the hospital if necessary. And midwifery has taught me a lot about it. It humbles you, just like birth does, about when you do need medical intervention. I think it's always myself and a birth assistant. I have a student now too that will be present at the birth as long as the family's okay with the student there. And I think one of the biggest differences is postpartum care, because whether you have a birth center birth or a home birth, we're back in your home between 24 and 48 hours postpartum, check on you and baby, see how breastfeeding's going, and then at a minimum, seeing you and baby in office 2, 4, and 6 weeks postpartum for a full 45 minutes to an hour, instead of just like 1 6-week postpartum check. So in our office too, we do a monthly postpartum group meetup where right now it's just my midwifery clients that are invited to it. And you can choose to have that in place of your 2, 4, or 6-week visit, or you can come in addition to your 2, 4, and 6-week visit. And then I encourage families to come across the first year postpartum, because we just need more support during the postpartum period. And pregnancy is typically this linear progression. And then birth also has its like curve. And then postpartum is a lot more up and down. And I think one of the biggest things that we miss now when we're so like connected via devices is that community and just being together with other women and helping us understand what it means to be supported at a whole new level, and that we deserve that. And that's not asking too much.
That and I think just that alone, like the two things you said, the education with your appointments is like that's something I feel so strongly about that I feel like I missed out on. I don't want to say that, but all of those things like the eye drops and the like testing, and I just did it because it was protocol, right? Like
Mhm.
is what they tell you to do. And so I went along with it because I'm like, well, this must be the right, because they're telling me to do this.
Yeah.
Like you have options, but nobody ever understands or educates. Just like I called and asked one of my, functional medicine friends that I have, like, hey, can I sit down with you to just help me understand what are the pros and cons of vaccines? Because even if I go online and look,
Yeah.
I don't know what information is reputable versus isn't. And so to have someone like you and your team to just like talk to and understand your choices and what's behind them is like so invaluable. So that's incredible that you're doing that. I think that's so important. And I wish so many more people had access to that. And then postpartum, 100%. It's like most times we have nothing. Like that's
I
it
know.
up and that's it. Right.
Yeah.
I know I could have used that, especially with twins. I mean,
Oh my gosh.
that first year of life, I don't wish upon anybody with twins, but if there would have been that support, or
Yeah.
there's people in my life that I'm close to that have had babies and really struggle with anxiety and depression. And, I wish that I could help them more, but I don't. I guess I'm not an expert, but in that, what would you say? Like, where can people look for help, or what can they do if they're struggling really bad with that, like postpartum anxiety and depression?
I really truly think that simply talking to someone, like saying it out loud to someone that you really trust, and just listening to you say, I'm not an expert. We don't need experts as much as we just need community, because even if you look at the research on doulas, most of the really good research early on with doulas is just a woman simply sitting with another woman in the room. It's just that presence or a meal or, picking up the other kids. And there's a ton of shame that happens if there's depression or rage or whatever for some people. And rage specifically is something that's been coming up for several women in my life lately, where it's, they're not necessarily connected to one another, but it's this theme of them coming forward and saying like, yeah, I'm a little bit embarrassed to admit this, or like kind of laughing about like, oh, I have this or had this rage, and then surprised when they hear like, yeah, that's pretty common and you don't have to feel that way. There's a ton of support just even through tinctures or through, there's all of these things that we can take to help or build community and find community in order to help. And we just have to do a different job of it as a society of but also taking some personal accountability to just not force ourselves back to X, Y, or Z, because we're moving at such a fast pace with society. There is just not space for the slowdown unless we're willing to create it ourselves. And that takes a lot. It
Mhm.
takes a lot in most people's situation to truly allow yourself to just be still and not be rushing back to work or this presentation or traveling here or whatever when your body is still very much healing. I really do think that the pace that society moves is not congruent with the pace that we need postpartum. And if we can have conversations about that during pregnancy for mom and for dad, that gets their brain turning on, how do I want this to look? Like I say the first few hours, the first few days, the first few weeks, the first few months, because they happen, as you know, like that, whether we talk about it or not. And then you find yourself looking back on like, oh man, I wish I would have done that differently. I wish I would have said like, no, thanks, I don't really want you to come over yet, or have someone come stay with me quite yet, and not feel the guilt as much around that. But if you don't process it in advance and like come from that place of peace and advocacy, it can feel a lot more stressful. So again, that preparation, but most humans do something different because they didn't like how it went the first time, right?
Mhm.
It's like, oh, I had this experience. I don't want that again. So let's do it different. And that's just human nature.
Then, and I think too, just kind of going along the same lines of this postpartum is there a typical a period of where people think like, oh, this is postpartum and now I'm past that, but they're still dealing with that symptoms, right? So if somebody's like,
Yeah.
he's almost a year old and they're like, I should be feeling different by now. I should be doing, back to myself by now. And
Mhm.
you're still feeling that. What would you say to that? Or it's not like, I don't think it's ever too late to like get back
So,
to being you and to being healthy and to like, you know, getting to that point of just feeling good.
sure. And I think like mentally, we process maybe the first 3 months as being postpartum. And in our country, most women are like back to work by then if they're working and things like that. And in other countries, you have an entire year. And of course, correct, it is never too late. And it does take daily choice and small self cares and like control your controllables that you can take care of yourself, or that you're, willing to do movement and get nourishing foods and do your breath work. And I just feel like all of these things, but it's really truly about the consistency in short periods of time than it is about like, you need a whole hour every day or what have you. But I think one thing that's important to talk about is there's a book, I reference this a lot when I talk about postpartum. It's The Postnatal Depletion Cure, and it's by Dr. Oscar Sellerick, who researched and wrote it because of what his wife went through, and
Mhm.
found that the most common time for full postnatal depletion, meaning like micronutrient depletion, physical, emotional, is 4 years postpartum. And
Wow.
that's like mind blowing to me still when I talk about it, but it's also not surprising at all because usually there's another baby by then. And so you've gone through at least 2 postpartum periods and you've returned to work and you like there's all of these things that you're trying to juggle and it can just feel like you're all of a sudden like on this hamster wheel and then you just tank emotionally and physically because you do have micronutrient depletion or hormonal, So if you're feeling that exhausted and that down, I do think it's important to see someone that's in functional medicine if you can, that's going to get to the bottom of some of those answers and might be a simple fix for you. And even just different supplements and things you can take to help support yourself through that time. But it's like such a balance in talking to moms about slowing down and being supported, but also having enough self accountability and responsibility to take care of yourself and start somewhere, even if that means a 10-minute walk a day and just letting that snowball positively because we need a community built around us and make sure that your people are positive so that you're feeling more supported in being the best you that you can for you first so that you can give to your family.
Then, and I think with that goes to like not feeling guilty for taking care of yourself. Cause
Yeah.
as moms, like we're often the people that like, even though I have an incredible husband and he does so much, like I think there's still so much that lands on us just mentally and emotionally of like
Sure.
keeping things in. So I know what's helped me even just this past year was like journaling and just like 5 minutes. Like I don't have this perfect morning routine. Like it's impossible with 4 little kids. I feel just like
Yeah.
like if I write down what I'm grateful for and just like 5 minutes, that's been huge.
Yeah.
Just like getting your mindset right. But I think it's so interesting what you said about the 4 years because my youngest just turned 4. But last year I went through this phase where like my hair started falling out and like I just didn't feel good, like at an incredible rate. And it was kind of scary, but I went and I had like a whole nutrition panel, all this stuff. And my body was like so depleted on so many different levels. So it makes sense now with what you're saying of like that it's so far after, but I would never have thought of that. Like,
Yeah. And I try to emphasize that to my clients as well because we're human, right? It's like teenagers trying to teach them something that's like, okay, yeah, you'll get it someday, but right now when I'm telling you, listen, you need enough protein and you need to get off of your screen and all these things, I sound like I'm harping on you because I care about you and this is going to affect your health. And yeah, we're human. So usually it's like, oh, okay, sure. And it isn't until you're in it and
yes.
then it's like, okay, wow, yeah, that she wasn't kidding. This is so it's like taking your prenatals and doing your movement and let's talk about and it isn't about being perfect. It's about consistency and like trying to do just like 1% better. Most people you can say, can you try? Do you think you could do like 1% better with that or be 1% more consistent with that and just start that spiral? But the other thing with it is that transitiony feeling. And what made me think of this to bring this up is you talking about journaling because I too love to journal. And when, I don't want to say if, when I get out of habit with journaling, because right, we do it and then it's like, oh, things are going well and blah, blah, blah. When I come back to it, it feels like in my chest, this like, okay, this isn't free flowing, or if it's meditation or prayer or whatever, it's like my mind is busy. This feels like tension instead of peace. But all transitions do. And until you get into that practice, you have to get through the hard transitions in order to get to the benefit of it. Just like labor, there's like so many metaphors for life that match up with the stages of labor, especially with transition. Transitions are always the hardest. So when you're starting a new practice, you might feel like crap when you're trying to walk a mile and you haven't in a long time, or returning to getting back to the gym because it's been years, it's going to feel transitiony. But you know that on the other side of that, there's usually a little more bliss and peace and it's like just so much emotional and physical benefit to even just to navigate something hard and come out on the other side of it.
And one more question. Well, I have two questions, but I'll keep them short because I know that we could talk all day on this. But I'd really would love to dive into a little bit just because we haven't today on chiropractic and
Hmm.
how that's really important for mom and for baby, whether it's like you said, even before you conceive and then all
Yeah,
throughout pregnancy as well.
absolutely. And I think it's like right back to what I talked about earlier with the ability to move your body really well. And I am a firm believer that, again, as chiropractors, we are doing brain body work. And what is happening when we're placing our hands on people is we're bringing more awareness to that part of their body that they need. I mean, especially, you could do a whole episode on pelvic shame and disconnection. And there's some actual cool research on getting the pelvis adjusted during pregnancy and the relaxation that happens in the pelvic floor. And there's just so much energy and power in the pelvic bowl. And when you can move your pelvis and your spine and your soft tissues are balanced, you're going to feel better. You're going to be more in touch with your body. You're going to have better access to freedom of movement and more confidence in doing so. And that can change your birth outcome. And even if you don't have the birth that you desired, it will absolutely help you in postpartum recovery no matter what birth you have.
Amazing. And two, I know that just from listening to one of your talks before of just like how much space it can give the baby too if you're
Hmm.
adjusted, because then they have the optimum
Yeah.
be able to grow as well.
Yeah. Yeah.
And then
And if you don't have someone checking in on that, like our habits are our habits. So if you go look in the mirror, like the people listening, I want you to do this after you're finished listening, is go look in the mirror and stand up straight. Like find a upright, straight posture, and what you feel in your body compared to what you see in the mirror is going to feel so foreign because to us, neutral is what our habit is, right? So when you're getting body work done during pregnancy, there's someone that you're trusting to bring awareness to your body that you might not have in that moment. And, or for whatever reason, there's like repetition in your work or in your driving or whatever. And so there's tension in one side or the other that it's not even on your radar because you're used to it. But someone else that's assessing you maybe for the first time or at least newly during pregnancy is going to be able to start to see some of those patterns and help you. What I say to my patients is like, listen, you're in my office and in my care for about 15 minutes. And what you do outside of here is going to make the biggest difference. So it's my job to find the primary driver of if there is an issue, whatever that issue may be, and then help you figure out why it's happening and how to avoid it when you're not in here. Because the other 23 and a half hours of the day are going to make the biggest difference,
mhm.
not just the adjustment itself. It's like what goes along with that to help people unwind throughout their system.
And that you now that you say that too, since I've been getting adjusted, there are things that I like notice because it's your daily habits, right? And so being able to just have that like realization or notice when you're doing it, like even that little shift can be huge as well.
Yeah.
And then what about the baby, adjusting the baby too once they're born? Like,
Yeah.
what do you say about that?
So I love so much that most of my clients, they're okay with me doing some cranial work or adjusting baby a couple hours after birth. And it can make such a difference for breastfeeding and for developmental milestones across the first year, which it seems like really right away like that. And first of all, if you're listening and you're thinking, holy cow, a baby getting adjusted, it's so different than adjusting an adult. Babies are mostly cartilage. So it's more of a like soft tissue movement or helping them find equal rotation side to side and checking in on their reflexes. And that done relatively quickly can change the trajectory of their breastfeeding relationship,
Um,
their developmental milestones, because our habits also largely affect babies' habits and movements, right? They're drawn to light, sound, and smell, specifically from mom. And so we're creatures of habit. We're usually carrying them on the same side or they're sleeping on the same side of the bed and what have you. And so when I can educate and start to help parents see some of that in addition to catch anything that maybe there's tension on one side or the other or different parts of the spine, because again, it isn't like their postural reactions start when they come out. They were a certain way in the womb. And ideally, they had equal space and were able to move where they needed to find their best and easiest and most efficient route out. But sometimes they get a little bit like, turned one way or the other, and they end up holding that position for longer than is ideal. So they can have tension as well.
And then do you, for babies, is it like, oh, let's adjust them once a week or once a month? Or
Sure.
is it just different for everyone? Is there not really like a cadence that you would say?
Yeah, in my practice, I it's different for everyone. I like to see the babies on that like 2, 4, 6 week outline, if you will, or timeline, if you will, and then kind of see from there. But like, let's say everything, and I know some chiropractors see children far less and some see them far more frequently. But I say to parents, like, even if baby is moving extremely well, my version of a well child visit is based on the developmental milestone schedule
Mhm.
rather than other schedules. So I want to see them every 4 to 6 weeks, even if to the parents everything's going really well. I want to make sure that they're meeting those milestones well, like healthy and equally on both sides. And then I always say, like, and if something comes up in between, then for sure bring them in. So usually I see them even more frequently than that, but that's kind of like the bare minimum is once they're 6 or 8 weeks old, is like I would love to see them at least once a month across their first 12 to 15 to 18 months just to make sure that they're doing really well. And a lot of the work that I do with infants is movement based. Of course, adjust them if they need to. And I just got more into doing more fascial work with babies, and DNS is it's dynamic neuromuscular stabilization is the technique or modality that I went to Prague to learn more about. So I use a lot of that, and it's really truly developmental milestones and then making them playful and adding resistance to them and helping babies really like learn and access both sides of their bodies because they're creatures of habit. So whatever is easiest for them is where they're going to continue to go.
Okay, yes, we could talk forever on just that because I think that is so interesting. But I know that we don't have all day. So for a woman who is listening right now, who knows she wants to experience her next pregnancy differently or even
Mhm.
her first going into it with this type of level of care and support. And I know you're only in, one area and we wish that you were everywhere, but what's what's the first step you'd tell her to take or something that they could just start now?
If you're obsessed with birth like I am, like if it really intrigues you like it does me, I would really read the book Pushed by Jennifer Block. At this point, it's an older one, but it's so good. And it just really opened my eyes so much to why where we are with birth in the US. And then I would say find the community midwife in your area and just have one visit with them to ask them any questions you might have and maybe interview a couple because again it's really important that you feel supported in this whole experience. Just know that there are so many options out there and continue to settle back in on what instinct feels like in your body and follow the strings that come from that place rather than the strings that come from places of fear, and that will help you along the way in your pregnancy and labor and postpartum, but especially parenthood.
Well, thank you so much. I really appreciate you sharing all of this. I know I learned a lot and now I have like lots of other books I need to read. But where can our listeners find you if they want to connect with your work or if they're local to the area and want to come see you? How can they connect with you?
Yeah. So you can on Instagram, mostly on Instagram at the Movement Midwife or the Birth Collective pages at Coulee Health Birth Collective. And that's where you can find me as well too, or CouleeHealth.com. if you are local and wanted to schedule anything for midwifery or for chiropractic. But you can also schedule like virtual consults on there if you have different sorts of issues with core, pelvic floor, or pediatric movement, things like that.
Thank you so much, Erica. I so appreciate your time today. And I will have all of the information links available on the show notes. Thank you for being here.
Thanks for having me.